Dr. Stephen, I would like to talk to you about dentures. First of all, are you doing dentures?
Yes, we do.
Yeah, dentures. Now, there's lots of, people, they have dentures in every year or two, give or take. Some people keep thinking that their dentures get loose when it really is that their bones are shrinking. It's not, it's like with the trousers, it's not that my trousers are getting tighter because they go to the cleaner, it's that my belly is getting bigger. And with the dentures, it's the other way around. The bones are getting smaller. And there is this relatively new thing, it's not that new, but lots of people still who have dentures seem to be not having it, and that is implant-supported denture. Tell us about it and tell us how good or not good they are, and because they must be a lot cheaper than, that I call it a hybrid. I mean, on one end you have dentures, and I assume, not so sure, that most people who have dentures, it's a price thing, compared to, I don't know how many implants, 20 implants or whatever it may be, versus a denture, but the price must be huge different. So if you can have a couple to 3 implants in the denture, it's a little more than a denture, but drastically less than a full mouth of implant. The question just is, what's the difference in quality of eating and everything else? Can you tell us about it?
Well, a denture without anything solid to connect to is like if you put your finger on your hand and the skin and the tissue underneath the bone moves around. That's the way a denture is. It sits on the skin, the mucosa of your mouth, and there is some movement. When you put implants in that connect to the denture, it snaps in place, and you can chew far more superior to what you could without the movement of the denture on the gum. It would be directly supported by the implant, which is connected to the bone of your jaw. So there is no movement.
Now, let's just say you have this implant-supported denture, this hybrid, and you eat a steak, an apple. Can you even do it? Can you chew on a steak on an apple? What is kind of like, the difference between an implant or a denture, or for that much a real teeth implants or an implant-supported denture and a non-implant-supported denture? How happy is the patient with his implant-supported denture on that scale?
An implant-supported denture is far superior. The lowest end of that scheme is a tissue-supported denture, one that just sits on the gums. The next step forward would be an implant-supported denture. And then, of course, the far superior is good, healthy, natural teeth.
Okay. Now, can a person with an implant-supported denture eat a steak, bite into an apple?
Yes, most of them can.
Beautiful. And I have heard that when you have an implant-supported denture, on the top with a normal denture, you have this liner over your palate, and because of it, you can't feel hot, cold, and can't really taste food, because that's where we really taste the food. And when you have an implant-supported denture, that alignment goes away, and you again can taste the food. Is that totally true, or is that a little bit fibbing?
No, that's absolutely true. When you have a denture supported by implants, you don't have to have the roof of your mouth covered with the acrylic of the denture base. The denture base has to be there when there is no other support except the tissue, because otherwise you will never get suction. With an implant-supported denture, you do not need suction. It snaps and connects directly to the implants and stays in place.
And it can be taken out, or must be taken out.
And you can snap it out. Yes.
Wonderful.
You can clean it. You can clean your mouth and snap it right back in.
And what about your bones shrinking, and because of that you get that tomato look feeling and that flat face. Is that still happening with that implant-supported denture, or is that greatly arrested?
No, that fills in all the cosmetic issues of the cheeks and lips sinking in. That will support and restore any bone resorption that has occurred, and in the areas where the implants are placed, that shrinking of the bone stops.
And no more ever getting the feeling of maybe not necessarily really happening, but getting the feeling of maybe your teeth are coming out just simply because you have that big, huge laugh at dinner table.
No, you're not going to have to worry about it dropping out into your plate in a formal dinner, or if you sneeze out in your boat fishing, it's not going to be at the bottom of the lake.
Beautiful. Thank you very much, Dr. Stevens.
Thank you.